Pasteurella multocida is bacteria that commonly causes abscesses, respiratory infections, and chronic inflammatory disease in rabbits. It can infect the nasolacrimal tear ducts, eyes, ears, and nose, and can cause abscesses of tooth roots, bones, particularly the jaw, skin, tissues under the skin, and internal organs. This organism commonly causes an upper respiratory tract infection often called snuffles, which frequently occurs in young rabbits. Many cases of snuffles are mild, involving slight ocular or nasal discharge and sneezing, and, if caught early, can be effectively treated or managed. If left untreated, this infection can progress to become severe, chronic, and potentially fatal. A swab for bacterial culture and antibiotic sensitivity testing can be taken of ocular or nasal discharge to help guide treatment. Treatment usually involves either oral or injectable antibiotics, given for a minimum of 2 to 4 weeks. In some cases, treatment can be required for months depending on the response to therapy. Certain oral antibiotics, especially oral penicillin and similar drugs, can be fatal to rabbits. These antibiotics upset the normal gastrointestinal bacteria, leading to overgrowth of toxin-producing bacteria, diarrhea, dehydration, and death, and should never be used in rabbits. There are safe oral and injectable antibiotics prescribed by veterinarians to treat this infection in rabbits, but none leads to a definitive cure. Eye drops and nose drops, as well as oral anti-inflammatory drugs, may be used in conjunction with other antibiotics, as prescribed to your veterinarian. Pasteurella multocida can infect the tear ducts, eyes, ears, and nose, and can cause abscesses of tooth roots, bones, skin, tissues under the skin, and internal organs. Rabbits with abscesses in or under the skin, in the jaw, or in an internal organ often require surgery to remove the abscess. Abscesses in the middle ear, causing balance problems. Eyeball, causing blindness, or in bones or major organs are often difficult to treat and may recur, even with surgery. All rabbits carry Pasteurella organisms, but only some rabbits will manifest disease. Their immune systems generally keep the organisms in check. Stresses such as poor nutrition, changing diet, introduction of a new pet or person in the house, overcrowding, environmental stresses, immunosuppression, or the presence of other disease, may trigger clinical signs. Many rabbits are chronically infected. The disease is easily transmitted between rabbits through direct contact with infected rabbits, nasal or ocular discharge, contact with pus from an abscess, or contaminated items such as bedding and food and water bowls. New rabbits should be isolated for about 1 month before being introduced to existing pets. Even with successful medical or surgical treatment, relapses may occur if your rabbit is exposed to stressful situations. Be sure to have your rabbit checked annually by a veterinarian to keep him as healthy as possible to minimize problems with pasteurellosis.